One brain or two? This study started off with a man named Sperry who had a very large brain. Sperry had some wonderings about the brain and wanted to see if the two hemispheres really did work cooperatively or if they could each work independently. Consequently, Sperry decided to conduct many tests on different people to see how the brain worked. Once the 60s hit, he was joined by a man named Michael Gazzaniga. Although Sperry was the original psychologist behind the study, we use Gazzaniga's studies to demonstrate these examples because of their clear and concise methods. Before we begin, you should know that there are two main parts of the brain, the left hemisphere and the right hemisphere. The reason that Sperry began the study is because he thought that each hemisphere did different things and had different functions, and he was right. The brain is divided by the corpus callosum, which separates the two hemispheres. The corpus callosum is very important because it sends messages from the left hemisphere to the right hemisphere and vice versa. However, in order to run these tests, Sperry and Gazzaniga were going to have to find someone who did not have a corpus callosum or had it severed. This was not going to be very easy because most people are born with a corpus callosum and not very many people are going to allow you to just let them cut theirs in half. For a little while, they thought this study would be very close to impossible because it'd be unethical or unmoral to do this. Until one day, the perfect, I say with air quotes, scenario came across. Gazzaniga and Sperry had found patients who were suffering from severe seizures. The only treatment was to cut their corpus callosum in half. How convenient. By having a split-brain patient, this allowed Gazzaniga and Sperry to do tests on each side of the brain individually. The tests they ran on their patients were the visual abilities test. With this test, the split-brain patients were told to sit in a chair with a board of lights in front of them. They had to stare at the board and were given a focal point to look at. The Sperry and Gazzaniga then would flash the lights and the patients just had to stare at the focal point. Once the lights had flashed, the patients were asked what they had seen. Since they were split-brain patients, they said that they only saw the lights on the right side of the board flash. Isn't that strange? This is because the left side of the brain is responsible for speech and the right side of the brain does not have speech skills in it. Therefore, they could not vocalize what they are seeing in their left visual field, which correlates to the right side of their brain. Next, Sperry and Gazzaniga had just the lights on the left side of the board flash, which would shine in their left visual field and go towards their right hemisphere. By doing this, they would not be able to vocalize what they saw because the right hemisphere does not have speech capabilities. When the patients were asked what they saw, most said nothing. A common conclusion to this phenomenon is that the right hemisphere of the brain has no visual capabilities. But this is false. We know that isn't true because the patients were then again asked to sit in the chair and look at the board. They were flashed the whole board of lights and were asked to point to which lights had flashed. The patients were able to point to all of them. This shows that they knew all the lights had flashed and could see the lights in both visual cortexes. The right hemisphere receives visual stimulus, but it cannot say it because there is no corpus callosum to send the message from the left hemisphere to the right hemisphere to say it. The next test involved tactical skills. In this test, each patient was given a bag with a spoon, a pen, a book, and a watch, and held this bag behind their back. They could not see what was inside the bag, they could only use their hands to feel. The first time an object, for this example we will be using the book, was placed in the patient's right hand. The right hand connects to the left hemisphere of the brain, so when the patient felt the book in their hand, they were easily able to vocalize that they were holding the book. All the trouble comes when you put the book in the patient's left hand. When the patient was holding the book with their left hand, not being able to see it, they felt it, but they could not say that they were holding the book because the left hand connects to the right hemisphere of the brain, which does not allow for speech. This time, Gazzaniga and Sperry placed the book in the patient's left hand, and the patient was told to point to what they were feeling or touching based off of a couple objects that were on the table in front of them. The patient could do this as easily as you or I could and pointed to the book within seconds. The final test conducted was the visual plus tactical test. There is my dog. In this test, the patients were flashed an image like a flower in their left visual field. When asked what they saw, again, they said nothing because that was the right hemisphere of their brain and they could not vocalize what they were seeing. However, after they answered, they were given a bag with multiple objects, including the objects in which they were shown. The patients were then able to use their left hand to feel for the objects that matched the image they were shown. As a result of the study, we were able to find that the left hemisphere of the brain is responsible for speaking, writing, math, reading, and language. The right hemisphere, on the other hand, is responsible for recognizing faces, solving problems involving spatial relations, and artistic activities. These findings are very important because it helps us to find the sole problem of certain brain injuries and how to fix them. Especially in strokes, because usually when a person has a stroke, it really damages one specific part of the brain, and if we know they're not talking or they're having difficulties talking, it is most likely has damage to the left side of their brain. The end.